Hello, ladies and gentlemen. Welcome to the first panel discussion of HealthX Conversations presented by Optum in association with CNBC-TV18. Now, our discussion today on health innovations will delve into the strategic, the structural and the functional aspects of the $30 billion opportunity it presents in India. We'll explore how health innovations can improve efficiency and patient outcomes, the importance of partnerships between private, governmental and research entities, and ways in which India can augment its talent pool of healthcare innovators and emerge as a global hub for healthcare innovation. To hold forth on these matters, we have with us a panel of eminent leaders with us today who bring to us a rich mix of perspectives from their vantage points in the areas of healthcare policy, technology and business. Please welcome Dr. R.S. Sharma, Chairman, ONDC and former CEO of the National Health Authority, Mr. Shashank, ND, co-founder of Practo, and Ms. Ratnam Krishnan, Managing Director of Optum India. And joining us virtually are Ms. Ameera Shah, Promoter and Executive Chairperson at Metropolis Healthcare Limited, and Ms. Sangeeta Reddy, Joint Managing Director of Apollo Hospital Enterprise Limited. Ladies and gentlemen, welcome to HealthX Conversations. Dr. Sharma, let me break the ice with you, coming to you. You've been a part of this healthcare innovation ecosystem. You've made a lot of changes as a part of Ayushman Bharat digital mission. That was something that was at the fulcrum of the government's healthcare push, digital push as well. So tell me, when you talk about this integrated health apparatus, what were the challenges that you faced and then overcome when you talk of access challenges, logistical challenges that you were able to overcome?
Well, thank you very much for inviting me to this conversation. I will begin that, we had COVID and we were fighting COVID and I was brought into the National Health Authority as, the chief of COVID. And while building COVID, I was also posted and working on some of the other aspects. And the idea which came to us was that can we not create a similar kind of digital public infrastructure, which we have done in the sphere of identity, in payments, etc. So that is where the whole Ayushman Bharat digital mission was born. And the whole idea of it is how can you build an architecture of an inclusive, privacy preserving, federated data structure, patient-centric health delivery system. And these are some of the basic overarching principles on which we built Ayushman Bharat digital mission.
Sure.
It is not a solution, but it is essentially an architecture and a framework where the service providers, all private, public, can interact, can exchange data, can digitize data, and then of course the patient being the ultimate beneficiary can benefit from this whole digitization process, whereby he does not have to undergo diagnostic tests again and again and again. He is able to share the records, his digital records, with the doctors or the service providers to whom he or she visits. And then how can we create also something that is privacy preserving. It does not violate, it is consistent with the DPDP Act, which is at that time it was a bill and now it has become an act. So how can that also happen? So essentially it brings the interoperability, the open standards, the open APIs through which the private sector can communicate and can sort of talk to the system, and finally it brings the access and affordability.
So clearly we're talking about a big opportunity here. And in fact, speaking of that big opportunity, Ms. Reddy, let me also get you in on this conversation. Some of the numbers that are thrown across is that this healthcare innovation opportunity, the market that we're looking at, is about $60 billion by FY28. Very large numbers this. What does this represent from your perspective? How are you looking to contribute towards and perhaps benefit from this $60 billion opportunity?
So first, good afternoon. Very happy to be amongst all of you and discussing something which is of significant importance in the quest to bring accessible, affordable healthcare to everyone. It is undoubtedly a huge opportunity because it sits across multiple spheres. It sits within the hospital in its core IT infrastructure, in the applications like hospital information systems. It sits across the ecosystem. So whether a large hospital like ours is doing teleconsults for a rural center or manning the ICU of a hospital in a tier 3 city where they don't have a critical care specialist. So many use cases are emerging. So I'm often hearing that data science is very powerful, and I agree. And now I think we've reached the inflection point where implementation science is adding on. So we're embedding these use cases and this technology into every aspect, whether it's early detection. So you use AI, say in mammograms, to do early detection of breast cancer. And the implications of this are huge. We look at early warning symptoms in our ICU, so you can predict sepsis early and then begin treatment earlier. You're looking at standardization across care continuums, and therefore we're empowering all levels of healthcare workers to do more because the knowledge is at their fingertips. So much of the $60 billion opportunity is actually, in my mind, an opportunity to serve more and more people and to enable access, because knowledge is reaching multiple areas of healthcare workers of different geographies and even in patient homes.
Speaking of the opportunity at hand, Ms. Shah, let me come to you. Again, the numbers here, this is clearly a space where there's a keen interest. The last 2 years alone, between 2022 and 24, we've seen investments north of $30 billion. Clearly an exciting space. What would your word of advice or suggestion be to investors who are looking to partake in this journey and tap into the India growth story?
I think India is obviously a very exciting place, and it's right now the blue-eyed boy in many ways, definitely for healthcare investments. People across the world are looking at the opportunity in India and saying, look, how can we make this real for each of us? And I think the opportunity really in India is about not only access, as Sangeeta mentioned, but it's also about, doing things really well. Often we talk about Indians, in small towns, small villages, having access, but often that access is from players which are not necessarily standing up to minimum standard, which then gives them poor quality healthcare, which then doesn't help them at all. So I think the real magic in this is to say, how do you take the best healthcare organizations in India? How do you use technology to then create that access, to take it down to every small village, and available there? And I think in healthcare, while there's a lot of focus on numbers and a lot of focus on P&Ls and EBITDAs, the reality is that patients and doctors remember those organizations that truly make a difference in people's lives, in actually being able to change things and being able to bring positive outcomes. And to do that, you not only need to have very strong, fundamental business models, but you also need to build the right culture. You need to build the right technology platforms. You need to ensure that whether it's data privacy, whether it's your errors, whether it's your customer care, you really have the ability to have very data-based organizations where everything is monitored down to the T, and it's not just based on individuals. And one of the big benefits I see of technology is really the concept of collective learning. Often in the medical field, it has been all about the knowledge of each individual doctor in their brain and in their mind. And technology gives us that ability as to say, how do we institutionalize that knowledge? How do we bring it to a stage that there is collective learning?
While we speak of innovation, Ms. Krishnan, let me come to you. One trend that we're increasingly seeing is hyper-personalization, customization in healthcare. Is that a secular trend which you see continue to grow forward, which will continue to grow forward as we have more adaptation of emerging technologies? Ms. Reddy was talking about AI. Is this something that will continue, this momentum will continue going forward?
Yeah, I mean, we've heard some really significant fundamental shifts that we've been talking about, right? And one of the areas of keen focus is hyper-personalization. I mean, simply put, what is hyper-personalization? It's a very targeted approach to delivering healthcare, but with a digital or a technology wrapper around it, right? Now, if you think of hyper-personalization, let's look at this through maybe 2 or 3 lenses, right? First, let's think of it as the consumer need. Now, consumer need or the patient need is fundamentally at the center of this hyper-personalization. It depends on where they live, where they work. Ms. Reddy was talking about, the ask in rural areas is different from what's potentially in urban areas. So the same person, say a mother who's expecting, right? That individual's requirement in an urban city will be quite different from if they're in a rural city or a tier 3 location. But it's really about your requirement of what you want, where you work, what's your lifestyle, and therefore the consumer need is starting to become quite central to the approach in delivering healthcare. And therefore the consumer is also, and nowadays we know a lot of information, we can hear a lot of information search. So we are kind of in a way taking responsibility for our own health journeys in many ways. We kind of understand that. So that's one that's clearly driving this. The second, therefore this then gives you the opportunity to actually customize the offering, make it more flexible, do add-ons, do the right kind of products and services that the patient actually needs. So that's again at the center of it. The third one is an interesting one, and we talked a little bit about it, is how do you use AI, how do you use data and analytics to actually get insights? And this is the interaction between the clinician and the patient, the patient who needs personalized care.
That's an interesting cue to my very next question. Mr. Shashank, let me come across to you. I'll just dial the conversation back to a few minutes before we began this broadcast, where you were giving some very interesting insights. Tell us, what in your experience has been the phenomena of integrating these emerging technologies into Practo? How are you deploying them? How are you using them for meeting the diverse healthcare needs across the country?
Thank you. Good afternoon, everyone. It's my pleasure to be here. I'll just talk about, when you talk about AI, when you talk about the latest in healthcare technologies, the first thing that comes to everybody's mind is how are we going to gain trust? And trust is gained by being able to deliver repeatable health outcomes to individuals. And then the question begs is, how has this happened in the past? I just want to jog our memory back. In the 1700s, it was the stream of biology that led to the evolution of the modern day hospitals. That's how physicians came together. And then in the 1800s, it then went on to the discovery of vaccinations. And that was the new stream, that's the next stream of science, which was chemistry, which came in, and that's how the pharmaceutical industry was formulated. In the 1900s is when we got the modern day X-rays that came into being. That's the use of physics, which led to diagnostics as a space emerging. And then, of course, biochemistry came through that. And then after that came the use of actuarial mathematics, which is how insurance came to be. This century is the century of computer science and data science. And that's the data science, computer science contribution to how health outcomes will improve. And so it's a journey of a century. It's a journey of decades where the use of computer science and data science will show empirical evidence in improving health outcomes. And that's how we need to measure AI or any new technology. Now, looking at what has happened is these two streams of science, which is working with all other different streams of science, is evolving at a much rapid pace, and is putting the focus back in the hands of the consumer. And through this, the first mode that's coming through is the ability to have quality healthcare being accessible to consumers. And I'll just reference this. In the earlier conversation came out that I have been to hospitals in the central part of Bangalore, where unfortunately, just because of lack of patient awareness, there are hospitals that are operating without defibrillators, which are required to revive patients. There are hospitals that have seen live lizards in the OT, in the operation theater. And this is largely because the consumer awareness is very low. With the right use of technology, if we are able to, and all of these instances lead to reduced health outcomes. I've seen places in dental clinics where I know consumers will not know this, but where rice cookers were used for sterilization purposes. Now, this is happening not in the remote parts of India, but is happening in the upscale parts of Bangalore. It's happening in upscale parts of tier 1 cities. It's affecting all of us. So that is where the use of computer science, data science can come in to be able to evaluate these centers and be able to figure out for the consumer the right choice to be provided in their ability to get the best health outcome. So this transparent information of where is the better health outcome available to consumers at an affordable price is what will lead to the right use of AI and telemedicine.
Ms. Krishnan, let me come to you. You had given an example that you'd gone to colleges and you'd asked how many students would want to take up healthcare, and the answer were only a couple of hands. So that's an interesting divide that you would have to actually bridge. You're looking at tech expertise on one hand and healthcare domain knowledge on the other. How do you bridge this gap?
Yeah, I mean, look, India has 9.5 million people graduating every year, right? And it's about, I'd look at it from a few lenses in terms of how do we bridge the gap, how do we get the talent on board. I think one is much stronger partnerships between academia, the health infrastructure, as well as the companies, the private companies. I mean, engaging them in terms of research partnerships on the technology research, live lab environments, getting people in for internships in a live lab. In fact, we've done that in the Philippines with some phenomenal results. So how do we actually really strengthen and get people working, studying, to be really excited about the opportunity and what it really means?
Sure.
The second one is around getting people engaged with the startup ecosystem. There's a lot of interesting things happening, right? Therefore, it's about for companies as well as for the startups, it's huge amount of mutual benefits. Also, what's interesting is on the talent itself. How do we get them ready, right? And how do we get them to understand the ecosystem? How do we train? From our perspective, I think we spend a lot of time and effort in real life simulations, getting people, an always on learning system. For example, if somebody is dealing with the elder people, we actually do a simulation and give them a simulated environment. What is life like and what's the day like in an 85-year-old's life, right? So for them to actually get an understanding of what this really means.
Wonderful. Let me take that across to Ms. Reddy. Ms. Reddy, again, the startup innovation ecosystem, India is blessed to have one that is teeming with a lot of ideas, a lot of discussion about the way forward. How are you engaging with this startup innovation ecosystem? How are you deciding which are the third-party solutions that you can look to integrate with your own network?
So it's a great question, Smith, because the pace of change is so much that we really can't build everything ourselves. While we have a tremendous in-house team who's done some great work with data scientists and engineers, we have partnerships with companies like Google and Microsoft and many others. We've worked extensively with research organizations like IITs and many of the others. MIT J Clinic, we've worked with them on the Mirai breast cancer system. But I totally agree with you that the energy, the innovation of the Indian startup ecosystem is an exciting opportunity, and they actually do like coming into our ecosystem because we understand the game. We have data which is well structured, anonymized. We do confidential computing. So it's an exciting partnership. We have an organization called the Apollo Research and Innovation. So all our startup initiatives get channelized through this. Much innovation has come out of it, whether it's in building our remote care services, our ability to create connected rooms.
Sure.
So this is with device organizations, because one of the critical words really is convergence. It's convergence of the ecosystem. It's convergence of the various technologies which are emerging. So as exciting as AI is, edge computing is, VR is the entire aspect of IoMT, because when we use the devices, miniaturization of these. So there are many, many emerging technologies. Putting these together and applying it into real world healthcare solutions is really what we are working on. And so when, I see this ability, like in a significant number of our inpatient rooms, we can do patches onto patients so that they're being monitored real time as if they were in an ICU. So this further brings down, and this is monitored in a central station where it's doctor manned. And then we have algorithms sitting on top of it of the early warning systems. So is the blood pressure dropping? Is there variation in the heart rate? So these kind of things. And this is done with, one of the startups who supplied the patches or the underbed monitoring system. Another very important one, much as we talk about all this data, the core of the situation is that the doctor, when he speaks to the patient, we need to capture that data. And getting doctors to either type or, others use solutions of you take the prescription and then you digitalize OCR. There were various technologies. But the most fantastic one was just 2 years ago, it was voice to text.
Sure.
And the international solutions were very expensive. We worked with a company called Ognito, a startup out of Pune, and put this across 35 of our hospitals. Then we went a step further. We've worked with them now, and they have perfected ambient listening. So this is contextual conversations being captured into your files so that your EMRs are getting auto-populated. So this is another startup initiative. So there are multiple startups we're working with, whether it's in, analytics of data for discovery, especially in, various diagnostic areas. There's work around technology platforms. There's simple solutions like how do you call the wheelchair at the right time? So there's a buzzing system and a monitoring system so that nowhere is a nurse or a patient waiting for a wheelchair because the closest wheelchair comes. So it's like an Uber for wheelchairs. We worked with that startup. And now he's actually become a very well-recognized international product. So it's been an exciting journey, and I wish the startup ecosystem all the best. I believe that there are, in our Chittoor Medical College campus, we actually have an engineering school. And we're seeing such a great excitement around biomedical engineering and the convergence of technology and science. So I'm very bullish about this whole space. I believe partnership is the key to solutioning.
Sure.
We just need to keep the value system right. So we are a little discerning about, the startups we work with. They must be based on good science. They must have the right, the system to say, I'm making healthcare a better place. It's not just the financial incentives. And of course, then the financials will follow. But the value system has to be right. And finally, I think involving clinicians into the building and the evolution of systems is actually one of the most powerful accelerators. So I really thank all the doctors who are spending their time on enhancing the health tech ecosystem with their time, energy, and insights.
Well, one key word that you've given us is, of course, convergence in terms of ensuring that all these different technologies, emerging technologies, come together and pointing in one direction. Mr. Shashank, let me get you in on this. When we talk of ensuring convergence between these latest emerging technologies, of course, they have to be manned. There has to be talent backing these technologies up. How much of a challenge is it finding that talent? Is your experience also the same as Ms. Krishnan's, that finding the right talent for healthcare innovation perhaps is not that easy, that there are challenges that you face? How are you overcoming those challenges?
Absolutely, it's a cycle. Health tech, I would say, has its journey. What we would all want is we would want our bright minds in India to be working on solving healthcare problems of 1.5 billion Indians, making them live healthier and longer, and then contributing to the rest of the world. That's what we would want. But unfortunately, it is a cycle. So it started with a lot of promise, a lot of capital got deployed. I would say that the entrepreneurs tried their best, and some made it, some did not. Some companies could innovate and also make sure that they were able to go from the investment towards profits. And that cycle is now coming to a close. We've had the first cycle of investments into health tech, and now the returns are what investors are looking for. And then I'm pretty sure that as some of the companies go public and that loop closes, there'll be more investments that will come in. Now, why are these investments important is that through these investments is how we can attract more talent, how we can attract more resources, because the building blocks are there.
Right. Ms. Shah, coming to you now. Firstly, congratulations. You're also now wearing a new hat, that of the president of Nat Health. Nat Health, of course, sitting at the helm of a number of different spectrum, a wide spectrum of stakeholders who are a part of this broader healthcare ecosystem. We're increasingly talking about emerging technology. We're talking about innovation that we've seen. You said initially that let's not target big bang disruption, but rather the smaller changes, the fine-tuning of changes. The question I'd like to ask you is that in such a dynamic environment, when you have vast changes across the whole host of stakeholders that we have within this healthcare ecosystem, how do you ensure harmonization between the stakeholders?
It's not an easy one, and I think it's not only harmonization between the stakeholders, but I think it's in the whole ecosystem, right? I mean, look, at the end of the day, the ideal situation is that you have government which truly understands what private sector is able to do, and enable it to get to the next level. You have private sector who all understand their responsibility and are all following minimum standards and good quality and not doing anything unethical and taking it to the next level. So if everybody was doing what they were supposed to do, right, but that's rarely the case. So I think really, harmonization is about figuring out the commonalities and the broad industry, things that affect everybody across spectrum. So, whether it's medtech, whether it's insurance, whether it's hospitals, whether it's diagnostics, I think the one common thing that affects all of us, definitely like I talked about, is the lack of a regulated landscape. In some cases, hospitals are over-regulated, diagnostics and medtech are completely under-regulated. So you have a really mixed bag. And the one-size-fits-all approach does not work. So actually in NatHealth, what we do is we segment each area and we try to understand the challenges of each area separately. And then try to work with the government to communicate what some of the areas of concern are and therefore what need to be done to solve them.
Wonderful. Dr. Sharma, that's an interesting point in terms of having two provider networks. We were just talking in the break when you were talking about interoperability, how that will be critical in achieving this common objective between both the government and the private sector. Your thoughts on that?
See, what is happening is that while a lot of innovations, startups, other kinds of things are happening in the private space, and each one of them is doing excellent work in that space.
Sure.
What is actually required is creating some kind of UPI of health, put it this way. When we created UPI or digital identity, they are horizontal, kind of digital public infrastructure, because payments are used everywhere. And you'll be surprised to know, Asmit, that who opposed UPI to begin with? The banks, the public sector banks, which opposed UPI, because they thought that by having an UPI, they will expose all their data to everybody else. So that's the fear which they had. But ultimately, UPI is benefiting everybody, because UPI has reduced the load on the public sector banks on their counters. It provides a common, outlets or common kind of interface to all the businesses, all the individuals, and today I can transfer 1 rupee to you and you will get exactly 100 paisa, not even 99. So it's free for use. So it has created last month we had about 17 billion transactions on UPI. Every Indian on an average transacted about 17 times in a month. So that's the kind of, and it has saved billions and billions of dollars in terms of cash management and other kinds of things. Similarly, the concept of UHI, the Unified Health Interface, similar to the Unified Payment Interface, is essentially envisages a situation where discovery becomes very common. So for example, I don't have to download Apollo app, Max app, X app, Y app. I just have one single app or one single interface whereby I am able to access the teleconsultations, for example, being offered by everybody else. So that can happen only when you come on a common platform, you come on a common standard, you actually subscribe to that. I'm a little disappointed, honestly, because when we talked about the ABHA number, we thought that every service provider, the diagnostic labs, the hospitals, they will all start using the ABHA. That is a common identifier. And basically participate in this Ayushman Bharat digital mission, so that a patient has access to all the health records and all the health facilities which he or she has interacted with. Unfortunately, it does not happen. Everybody wants to see others' data, but nobody wants to share their own data. So now you are creating silos. And if you do create silos, then you are killing many things. AI, we are all talking of, but as I said in the earlier intervention, that AI is all based on data. And unless you have the data, common data pool, anonymized data pool, things will not happen. And the architecture of ABDM does not say that you share the data in a common pool. We are basically saying that the patient is ultimately the data principal under the DPDP Act also. And therefore, he or she should have the complete control on his data. And the hospitals must enable that data access by the patient. So essentially that should happen. And frankly speaking, Aadhaar was a identity provision where there were two stakeholders. One was the people, another was the government. Similarly, UPI is essentially, there is only one artifact which is being transacted with money.
Correct.
And there are banks and other people. Health is much more complicated, much more complex. You have multiple stakeholders. You have the service providers of various kinds, health facilities, diagnostics, and you have the government, you have all kinds of stakeholders. And it's important for all of us to work together. Maybe we have to create some regulatory structure, but beyond regulatory structure need not be necessary if everybody can collaborate voluntarily. And that should be the basic objective of all of us, that we don't create, America, for example, in USA there are only two companies, Epic and Cerner, and they basically control 90% of the patient's data, and they don't talk to each other deliberately by design. And that kind of silos we don't want to have in this country. And the entire unique digital public infrastructure which the world is now emulating, and we are the leaders in that, essentially talks about interoperability, openness. Those kinds of concepts are there. It's a unique structure which is actually quite appropriate for a country of as diverse as ours. And therefore, this, for example, health claims exchange.
Sure.
Now, health claims exchange is essentially a pipeline which creates a unified way of submitting claims. Then, of course, payer side, provider side, both can come through this pipe, and there's a unified way. It's a very, very clear way. Hospitals don't have to have 20 fellows attributed to each Star Health insurance or XYZ insurance, nothing. So this is a kind of agreement which we should create among the service providers, among all these stakeholders, so that we are able to take it forward and we are able to fulfill the promise of providing health services in a very cost-effective and
So your message, Dr. Sharma's message is say no to silos and say yes to interoperability.
Absolutely.
Ms. Krishnan, let me come to you. We've been discussing, we had the stage set with the benefit of all of our panelists in terms of what's exciting them, what piques their interest in the latest in innovation. Let me then come to you and ask you that question. What are some of these exciting changes that are piquing your interest, that maybe give you hope as you look ahead at 2025 and beyond?
If we just talked about it, I think the three big challenges in healthcare are access, affordability or cost, and improving quality outcomes. What's the right outcome for the patient, right? We all know that access is really hard, and particularly quality of access, which we just spoke about in some of the more remote areas. Technology is, in my view, a fundamental lever which can change a lot of this. What's interesting though, technology and medicine or healthcare is intersecting in a big way for the first time. We were actually having a conversation with some students, a lot of computer engineers, and one of the questions was, okay, how many of you are actually interested in healthcare? And the number of hands that went up was maybe 2, because they're all computer engineers, right? And then the challenge is to help understand that technology is going to be a solution to many of this, right? It's not for everything, but it is definitely going to be a solution to many things.
Ms. Reddy, let me also get you in on this conversation. When we talk of these changes that we're seeing, we're talking about a digital wrapper around these innovations that we're talking about. I'm stealing words from you there. But Ms. Reddy, coming to you, when you talk of these changes that you're seeing, how do we as healthcare providers, how do you as a healthcare provider ensure that it doesn't exacerbate the inequities of healthcare access, but rather contributes towards bridging the divide?
So that's a wonderful question, Ashmit. I think, each one of these technologies, when you're able to reach the consumer better, faster, with credible information, and with simple directions on what to do. So one example of this is a product that we recently launched. It's a very simple app. It's an agentic AI. You can think of it as, the chat GPT of healthcare, but constructed at a price lower than DeepSeek, and using the kind of knowledge we've had for so long, and that's Ask Apollo. So a simple thing is, what do people do? What is the point at which they should seek out care? How do they get credible care? So guiding them through this automatically using years of clinical information and data and enabling the customer is really one of the most important things. But let me also just put a framework into how we're thinking of technology. I think the first one for us is clearly, what are we doing on clinical? From the wellness aspect of screening, prevention, risk, or from the treatment and curative aspect. And Uma spoke earlier about personalization. The other dimension that we're looking on personalization beyond geography and others is clinical individualization based on genomics. So if you have a BRCA1, BRCA2 test positive, then your treatment pathway for breast cancer is very different. If don't have a sensitivity to a statin, then we're not going to give you clopidogrel. So the whole clinical aspect and wellness aspect and using technology and data science to decipher appropriate pathways and embed them into our hospital information system and the platform. So this is the clinical intelligence engine sitting alongside the doctor. So this is step one. The second aspect after clinical is operations. So how do you, enable a customer to come in quicker, book easier, minimize waiting time, communicate to families who are abroad when their relatives are having surgery in the theater, make payments from wherever they are. All this is the operational aspect, which again, we're working on enhancing, embedding. The third is the financial aspect. So this is something I, feel deeply about for the whole healthcare ecosystem. And, Uma, who's from Optum, and this show is by them, is many years ago, and Mr. Sharma will know this, we worked together on this. We wanted to make sure that the Indian healthcare ecosystem had the lowest back-end cost per transaction compared to any country in the world. So India has this wonderful digital assets. So whether it's the UID, now the NHA building products, the fact that with IRDA, we have a standardized billing format. So the back-end cost of managing the third-party payment of healthcare and the COVID app, all these are examples to bring down the financial cost. Now we need to do a lot more. Insurance penetration must increase. Products made in India must go up so that we can ensure that the cost of input comes down, replication or duplication of tests, appropriate test at the appropriate time. All these are things that can further be enhanced using technology. So after clinical, operational, financial, the fourth dimension, which is equally important, and India has this tremendous opportunity right now, is the entire aspect of research, education, because we have to train our young clinicians as well as our practicing clinicians on this. We have to use the data that we have, and this is enormous, powerful data, to bring out new solutions, not wait for the West to give us solutions, but bring out new solutions, validate some of our ancient methodologies, and finally enhance the path to discovery. So this is the kind of, 5-angle lens that we are looking at and applying the data that we have collected over the years using what we call the EASE framework for application, which talks about ethics, applicability, suitability, scalability of these, and then protecting the customer's data. But across these dimensions, we continue to work to enhance our operations, our clinical outcomes, and our ability to access more and more people, either directly in the Apollo ecosystem or partnering with other ecosystems or assisting and working in PPP models with the government. For us, it's about, the best possible lives for our 1.4 billion people, and then living up to the next dimension of our dream, which is heal in India or heal by India, because doctors and nurses sitting in India can be caring and curing people who are sitting across the world who don't have healthcare or where healthcare is extremely expensive. So, our framework of thinking through technology applications actually comes into all these dimensions.
To Dr. Sharma, let me also dive back in. We had begun this broadcast when you had made references about how open sourcing is a key word when you're looking at developing these frameworks for making healthcare more accessible. How important is it for there to be collaboration between the three to bring about greater and more sustainable innovation, which of course is also equally price effective?
See, while I am a great votary of using technology in the health space, or rather for that matter any space, and that has been my area of work, whether it is governance or health or any other systems, I also believe that technology should not be only for a few not for few. It should democratize, it should actually reduce the transaction cost, it must really improve affordability. That's what is important. So the problem here is that it's not just a few million people, we are talking of 1.4 billion people. And therefore, from my perspective, I always think of how we can use this technology to reach the unreachable, to reduce the transaction cost, to become more inclusive so that people are able to access it. The problem of healthcare in the rural area is significantly different from what you have in the urban area or the middle class people. So, in rural area you have the quacks, and they have greater reach within the population itself, and they are all branding themselves as doctors while they are not even compounders. So those are very, very severe and serious issues which we confront. And therefore, what we had done, for example, in the Ayushman Bharat digital mission, I mean, let me give you a perspective. In the Ayushman Bharat PMJY scheme, India has created an insurance cover of 500,000 each family per year for 700 million population. It was 540 million, now that the Prime Minister has included the 70 years plus also. So you have now 700 million people. Now these persons, each of them is probably sort of accessing hospital in the rural areas, and therefore it is actually trying to figure out whether the fellow is eligible or not.
Sure.
And if eligibility is there, then he is trying to get access to the treatment. So it's a whole journey, and therefore technology must be permeating into every aspect of their journey to make this whole process, the transaction seamless, hassle free, and trouble free. So that's the objective. And with that objective, what has been done, as Sangeeta ji was saying, we have created this digital public infrastructure called Ayushman Bharat Digital Mission. One, there is a common identifier to each patient, which is typically based on Aadhaar.
Sure.
You have what is called ABHA, Ayushman Bharat Health Account. Like you put money in your account, bank account, you put your records, digital records, in the Ayushman Bharat Health Account. So it's like a bank account of the health records. That's one. That will ensure that there is an interoperability of the entire information across the value chain. The information, the records may stay in Apollo, records may stay in Max Hospital or whatever, but what is important is that patient should have the capability and command to essentially access those records and share with whomsoever he or she wants to share. That's number one. Number two, we have patients, we have the health professional registry.
Sure.
So as to ensure that only legitimate doctors and service providers are able to kind of do the treatment, not really the quacks. That's one. We have a drug registry, which essentially not only tells you about the drugs, but also tells you about the equivalence of those drugs in the generic medicine. So for example, if you have branded medicine, branded drug which is costing 100 rupees and a generic equivalent of that is costing only 5 rupees, then the patient should have a choice. Otherwise the health provider will write something. The patient should have that choice. So drug registry, health professional registry, health facilities registry, and then the application of a SNOMED CT, which is basically the entire sort of a space of all the interventions and all the diseases which are there. So essentially, we have created the common components which are going to be used and which are going to create efficiencies across the system, so that each one of them does not have to reinvent those systems. So essentially, once you create these rails, they will reduce the transaction cost, they will reduce the cost, they will make the system more affordable. So that is something which actually is the overall larger policy goal of this entire health ecosystem, number one. Number two, imagine in India it is estimated that we create 6 billion records every year, medical records, whether they are in terms of, I mean 1.4 billion people, 6 billion medical records is not a very large number.
Sure.
Now, if all these could become a part of that entire system, and somehow we could actually ensure that after anonymizing these records, we could use the AI on top of that to create systems, intelligent systems, which could give the diagnosis, all kinds of results. It's a wonderful thing, because ultimately we should not depend on the Western data or the Western things. Kala jar, for example, doesn't happen in any Western countries. This is a typical Indian disease. So essentially, what is important is we should build on top of the data, because please understand, we are all talking of AI, but we should understand AI is not depending on instructions, AI is depending on the data. The more rich data you have, the better AI results and the conclusions thereof will be. And therefore, it is also required that we incentivize patients to share their data, number one. And number two, we create such data repository which are anonymized, which are privacy preserving, so that we are able to create a common pool of that health ecosystem, which again each one does not have to reinvent the wheel. You can access, you can dip into the same common data.
Sure.
And you can do things. So essentially, India is a country where you have the community, and this is DPI is another version of the community resources being created, so that each one does not have to do that, and therefore it reduces the overall cost. So the affordability, quality, accessibility, which Ms. Krishnan spoke about, I think that's these are the very, very important words. And finally, patient centricity.
Sure.
The patient must be in charge. So these are some of the defining attributes, characteristics, overarching principles which we should have in order to ensure that these technologies reach the bottom of the pyramid.
That's such an interesting insight. I wasn't aware of that number, 6 billion medical records. And why not have Indian data for Indian patients for the Indian healthcare space?
Absolutely.
That's a very interesting insight. Ms. Shah, let me come to you. We're talking about innovation. Ms. Reddy at the very outset had talked about how we're moving on from data science to implementation science. So now we're getting to the stage of implementation of these innovations that we've seen. What are some of the learnings that you'd like to share that you've seen in deployment of these innovation changes?
As I was mentioning in the earlier point, currently we function in healthcare in a very in a sort of fragmented ecosystem. And to Dr. Sharma's point, it's a very valid point that bringing all these pieces together in convergence is going to be very important, not only to reduce transaction costs, but to actually get the industry to function together. So, what does that mean, and sort of how does it play out, and where does it sort of impact on innovation? So, part of what I applaud the government for is, this grand vision on really using technology to bring this convergence, whether of data, whether of records, because like you said, you can only build on top of that. But this will only happen the day that we are also putting minimum standards to say that the people who are allowed to play in the ecosystem are all on the similar standard, right? That is a minimum standard. And today, the biggest challenge actually is that there is no minimum standard. And therefore, you have all kinds of players in the government and in the private sector who may completely be following different standards, to Shashank's point as well. So I think a very important part of making this integrated industry work well and allowing innovation to happen is exactly that, is to first put minimum standards, right? That's very, very relevant. The second part of it is, where does innovation come from, right? Innovation comes from a desire for economics. It comes from a desire for better quality outcomes. It comes from a desire for access, from some need that people are really struggling with. And today, if you look at the amount of money that's coming into healthcare, it's actually coming more from a perspective of consolidation and less on innovation. Part of the reason for this is because it's such a difficult industry to work in. It's not an ease of doing business at all. And I think if we make the industry easier to work in, if we increase the talent pool as well, you will find actually many more investments coming into the industry, actually trying to build businesses ground up rather than only the consolidation play that we see going on right now from more financial suitors. Ourselves, obviously, at Metropolis, as we keep innovating and we're doing things, whether with AI or whether with just even simple processes around customers, we're finding some amazing things. I'll give you a simple example. We have obviously a call center which receives thousands of calls per day. And earlier, we were just a few months ago, we were able to do a random selection of maybe few percentage of those, maybe out of the few thousand calls, 5,000 calls a day, you're able to pick 100, 200 that you're able to do a random quality audit on to see, hey, are the calls going well? Now using AI, you're able to do 100% call audit, right? So just talking about the way customers are getting engaged with a monitoring system to be able to say that, look, are we able to check? A second example, we've got 4,500 centers across the country.
Sure.
Very difficult to imagine whether everything is opening on time, is it clean, is it not, and impossible to monitor on a daily basis. Again, we've used AI to actually now confirm that do these centers open on time? Using AI, you can check, are they following all the hygiene standards, all the minimum standards that a Metropolis center should have? So you're actually able to use technology for even improving small processes, which finally impact your quality outcome, your customer experience, your technical strength, and finally the culture of the organization, which makes you even stronger. So I'm quite excited to see how small innovations, and these don't have to be disruptive innovations. Often we get lost in these words of disruption because coming from the technology world, that's the most favorite word. And I think the government, what they are building is truly disruptive. But frankly, what private organizations need to be building are not necessarily disruptive things, but actually small micro process changes, which will disrupt their own processes within the organization. And by doing this, we will actually find that the incumbents who are building solid organizations are actually becoming more innovative, more agile, and more strong in the years to come. So very excited about that. And I think as an industry, we need to really look forward to the amazing future that we have in India, not only with investments, but with the kind of data access that we will be able to create through the government's initiatives, and by the kind of exciting things we're seeing in the predictive area of genomics as well.
Well, that's just a fresh insight that you needn't chase the big bang disruption, but rather the smaller fine-tuning of changes that you have within the system is something that will yield more long-lasting changes, more long-lasting innovation. Mr. Shashank, let me come to you. I'll borrow from the example that was shown by Dr. Sharma, where he talked about quacks in rural areas. India is a country where we have great digital connectivity. That is something that we almost take for granted these days. Health literacy, perhaps not so much. How do we bridge this gap in terms of ensuring that people are able to make informed decisions, informed choices?
Yeah, I think that's a fantastic question. And what we have been seeing is that with the use of AI, and I know this word has been abused a lot recently, and also has always been a promise of tomorrow. But what we have been seeing on Practo is, with the use of AI, we launched something called Practo AI. And through this, any part of India, any part of the world, people are logging in and are sharing their queries, sharing their anxieties on the platform. Over the last few months, we've scaled, thousands of users each month are now getting, this has been rolled out in a phased manner. And what we are seeing is that when consumers wake up with a health challenge that they feel anxious about, and they want a trusted resolution to it, they reach out to us, they talk to the AI, and when we ask them that, hey, there was a button next to this where they could have just a teleconsultation, or there's a button even after that where you could just go nearby, they feel that talking to the AI, they feel less judged, they feel more open, they feel less judged by a pair of eyes, and they want to have this very open conversation with the AI and be able to share for as much time as required all their anxious queries and get a resolution. And through that resolution, it could be that today you have a ball on your top of your eyelid, and based on the conversation and the questions that the AI has understood, it's able to recommend that do you need to skip work, head to a hospital immediately, do you need to take rest at home, Do you need to do a teleconsultation for a further investigation, and so on and so forth?
Your final comments in terms of this journey on technology and innovation going forward in 2025, beginning with you, Ms. Krishnan.
Yeah, I just go back to say my message is, access, affordability, and quality of outcomes. How can we use technology, not just technology, how can we make sure that we get our younger workforce excited about the problems? There are a lot of problems to solve, and I think, but there's a lot of excitement in terms of what we can do with the digital infrastructure. Sure. HealthX Conversations and our engagements with the key campuses in the country is one such. We need many more platforms. So my ask is really to say, how can we keep taking this message, to the talent in this country to say we want to solve these problems?
Dr. Sharma?
Well, I think the fintech is completely done in some sense. Now the next frontier is health tech. And there is, I think, tremendous amount of scope in that. But I think all this must be done within a given framework so that we keep on developing at a national scale, at a societal scale. I mean, I agree that there will always be providers who are very niche providers in some sense. That's fine, but I think on a general sense, we need to cater for the entire population of ours. And therefore, I think we need to have solutions and systems which are actually making that affordability, quality, accessibility possible for everybody in this country.
Mr. Shashank.
I would just would like to add that I feel that the time for computer science and data science as the two streams that can have massive impact on health outcomes has just begun. It's going to be a decade, it's going to be a century long this thing, and we should measure it by how we've been able to improve health outcomes in a cost effective manner. And if that is the measurement that everybody uses, I think we'll go a long way. It's just begun, and I think we're just seeing the tip of the iceberg, and very excited that we're all converging on the point that we need more talent, better talent coming to this industry to serve all of us.
Wonderful. Ms. Shah, closing comments?
I think we've talked about, for me, the 3 points are, taking access of poor quality beyond is not helpful. So minimum standards for patient safety is very, very critical. Otherwise we're going to land up in a much bigger fire in the future. As we talked about the convergence of the ecosystem using technology to bring the pieces, silos together, fully agree with Mr. Sharma around the interoperability. And finally, the clean data is going to be the most critical part of it. Today, we may talk about interoperability, but the reality is that even in our own systems, in each individual organization, data may or may not be fully clean yet. And therefore, each independent, whether public or private sector, focusing on cleaning their data and keeping those databases in the right way ready to be able to use for future is going to be very critical. Otherwise, we are going to be burdened with AI from the US and other Western worlds, which may or may not necessarily reflect the challenges in our country.
Wonderful. And finally, coming to you, Ms. Reddy.
So, I think it's such an exciting time in the world where we can actually dare to dream of a world without cancer, of a complete world with access to healthcare. And it's for us to create this future using these technologies. So it is affordable, accessible healthcare. It is a powerful focus on preventive healthcare. It's a convergence of technologies and applying them at the right place at the right time. And for the last 45 years, we at Apollo, we've worked to bring healthcare within the reach of everyone. We are committed to partner, to share. And Mr. Sharma, we were among the early adopters of this ecosystem and connecting our data. So we're committed to partner, to share, to innovate, and to bring solutions within the reach of, our patients and many, many others, so that we can build this better world. And we are excited about the power of technology, but we're more excited about the convergence of biology and technology to bring new solutions forth. So it's a wonderful time for us, and we must work together to enable this, because every day many people are denied care, and we have the power to enable deeper access. And that's what I'm committed to, using every science and every partnership possible. That's what Apollo's about. just reaching out and touching lives.
Wonderful. Well, it clearly sounds like healthcare will be the frontier for the most path-breaking innovations of our times, and we at HealthX Conversations cannot wait to see what they look like. Our sincere thanks to all of our guests, all of our panelists for helping us glimpse into new horizons of innovation in healthcare. We hope it has whet your appetite for the conversations which are yet to come. Do join us again on another edition of HealthX Conversations presented by Optum in association with CNBC-TV18. Until then, keep watching CNBC-TV18.